Good morning, and warm greetings to everybody from me, Dr. Ashish here. And the topic for today is self care when trying to get pregnant, taking care of yourself when you are on journey to get pregnant. So I support women and couples going through fertility issues. And if they've been trying to get pregnant for a while, over 2 years at least, or much longer, then I help them, support them with therapies and bespoke programs. So that's what I do. And today, as it is Sunday, and Sunday for many people is the day of self care, caring for themselves. So I thought we'll talk about this. And my plan was to come on live at 10, and I had a patient, so got delayed. So let's say sometime Sunday morning, I will be coming live. 10 o'clock is my desired time, but may not be always able to keep that time. So this live is also being recorded as podcast, and you will be seeing, or you can hear it as a podcast also. So please share. I keep asking this and requesting this. Please share. You never know who is struggling or who needs to hear a particular message of natural therapies, natural fertility, help with uh, the natural holistic therapies and programs. So keep sharing. So let's just discuss, go a little deeper into what do we mean by self-care and why do we need self-care when if you're a woman trying to get pregnant, if you're a couple trying to get pregnant, and you're a man, your partner, and together you are going through this program, regardless if you do know if you who has perhaps a little suboptimal fertility, or if you don't know that yet and it's unexplained fertility, even then both of you are going through this, then what can you do as a couple and also um, as an individual as well? So what are the things that that will help you going on this journey? And for some people, like I mentioned in the last live, which was about the whole stress of fertility, so this comes kind of as a follow up. Why do we, when there is so much stress, then we need to do something about it. And one of the things one can do is self care. And what do I understand by self care? What are my recommendations for you? So this is all about that. And of course, if you are somebody who's going through the fertility issues right now, you know someone, and then you have done something, then do share it with me. If something is working for you that is helping you to cope with the whole situation right now, then I would love to hear from you as well, because everybody has their own method, own way of coping with it. So, self care, caring for yourself, you as a person who has, um, even if you're not religious, like I'm not religious, but there is a sense of self. You have something which goes beyond this body, mind, emotions, and that inner self of you, we could also call it spirit. So that which has got layers and layers of physical body, mental body, emotional body, and other layers of around you, which make you as a person. So caring for all of that. And what happens when we are not looking after ourselves? So that's what I understand by self care. You as a person, you as a being, with all the set of everything that comes into play with that. So it does include your physical body, which we can see. There is mental body, psychological body around you. There is emotional body, and then we also have spiritual body, or spiritual uh, of you. So looking after all of them and caring for them. So let's see what self care is not, because many a times people think, oh, self care, oh, this person is, way too needy, or this person is just only think about themselves, or they are selfish. So self care is not being selfish. Self-care is not being excessively needy or excessively emotional. That's what it is not. And of course, self care is subjective as well. One person may need 5 hours of sleep and they feel good with it. What other person may need 10 hours of sleep on that particular night and they then feel good about it because everybody is different, everybody's bodies are different, we are subjective and unique. So that's where it differs. It's not always going to be the same. And that is where I feel perhaps that is where the issue comes up that, oh, I feel good with that much water content. How come you are still thirsty? Or how come you still feel you need more of this? So it's very subjective. So do understand that your needs are your needs. If you need to do something particular, if you are a person, if you are hurt, it's going to take you weeks and weeks for you to be adjusted with it and get on with it, then that's how it is. So first thing also is to understand how you are as a person. Some people say, oh, I don't know, and we keep beating ourselves up about it, that I'm not good enough, or why do I behave that way, or why do I take so long to deal with something. But that's also what, understanding about yourself, understanding about your nature, understanding about your emotions, how do you deal with things, and of course we can get better with it. If once we are aware, first is acknowledgement, then we are aware of it, and then we can do something about it. So understanding ourselves and knowing how much we need something, whether it's mental, physical, emotional, spiritual, all of that. What is my requirement of self-care? Yeah. And it is different for everybody, for men, for women, for overall as a unit, as a couple. It is going to be different for you. So understanding that. Yeah. And as I was talking about, self-care is not being selfish. Self-care is not being manipulative. Self-care is not being that you only care about yourself. It is not. It is about looking after yourself without being better or worse than anybody. It's not less or more important. Everybody is equally important, and everybody is equally need that time and space to care for themselves, whatever that may be. So it is not being selfish. It is to be aware that if I do not now eat and I'm hungry, then I am not going to be able to function for the rest of the evening very well, or I may start a headache, or I may become very cranky, or my mood may become really awkward, or I may behave really silly. So it's that. So taking care of yourself. And self-care is not something which we can't think, okay, I'm going to go through this whole, journey or whatever, however long that may be, especially we're talking about fertility journey, all these months and years. And then in the end, I'm going to sit down and relax. Many a times we do think about certain scenarios, but self-care is like food, water, sleep. We cannot defer it. It has to be done little by little on the side every day. The max you can do is sometimes if the situation is such, it is just an acute situation, you have to respond in that acute situation, and you haven't slept for 2-3 nights. That's fine, as long as you then balance it with for next week, or say for next good few 2-3 weeks, so that your body feels good, feel rested. So taking care of your body, your mind, your spirit, your emotions when you are going through fertility journey. And fertility journey for some people, as I was talking about last week, also, it's the nature of stress in fertility journey is chronic. It's just little by little, it keeps adding on to the stress, to the pressure, to the emotions. And if it is not balanced every day, if it is not balanced out regularly, then it is going to build up on you. And that's why taking care of your body, mind, spirit, emotions, your needs, sleep, all of that is crucial going along. And my recommendation is that self-care is about allowing some time, even if it is 5 minutes every day, to acknowledge it, to balance yourself, to recalibrate yourself, to assess yourself. Okay, where am I? Why am I behaving like this? So, taking charge of yourself, understanding really, why did I act or react that way? Oh, I'm feeling really hungry, or I'm feeling really annoyed these days, or I'm having constipation, which is not normal, which is not like me. That means there is something else is going on, and body is not balanced. Body and mind is not balanced right now. So, so, so taking that 5 minutes every day, if you have, yeah, and everybody should have 5 minutes to assess and realign themselves. If you have more time, you can do more things to balance yourself, to care for yourself. But if you don't have any time, then you must have 5 minutes. So that's my recommendation. When there is no time, then we must have 5 minutes to sit and to really to really assess ourselves, and not just constantly going on and on about, with all that goes on with fertility journey. Not just that thinking is going on, there is also, you might be going to appointments, you might be going for blood tests, you might be waiting for blood tests, you might be waiting for appointments in the waiting rooms. You might, if you're on IVF journey, that you might be injecting yourself with different hormones and drugs every day, and then also dealing with the side effects of that. So there is a lot that is going on in the body and also physically. And then there is a lot going on emotionally and mentally every day as well. So that's where taking that 5 minutes every day, and when you have longer, you can do longer. So let's talk about certain things that you can do from an Ayurvedic and holistic point of view, the things that you can do to care for yourself. And also, what are the signs of when you know that you're not looking after yourself? What are those signs? If you have noticed anything, do comment. If anybody is watching right now, if you watch on replay, then do comment. What are those signs which you have noticed in yourself when you're trying to get pregnant, or when you were trying to get pregnant? If you're out of that journey right now, then what was going on? And you thought, no, this is not normal. This is not me. And then you started to do something about it. You can share it with me. So the things that can happen when you are not looking after yourself, yeah. So digestion can go haywire. There may be constipation. You can have irritable bowel when you're not looking after yourself, or you are constantly thinking and worrying about things. Your sleep can get affected. One of the big ones is sleep starts to get affected. And you may not be sleeping well, or you may be waking up too many times, or you may be waking up hungry in the middle of the night. Then your skin might become dry, your hair might be falling out. What else can happen when we are not looking after ourselves? You might be feeling hunger pangs through the day. You might also be very moody, irritable, and irrational as well. You may lash out at people. You may feel really angry, which you think you're not able to control it. Of course, that in itself is going to unbalance the whole thing down the lane, which is your hormones, your sugar levels, your insulin levels, your the balance of apologies. So the balance of your whole being can get affected down the line, because our body is working in real sorry. So your body is working in it's like a continuum, and also one thing depends on the other thing. So hormones are linked to every other biochemical in the body. Every other biochemical is linked to your hormones. You have hormone receptors everywhere in your cells. So it's not only that hormones are restricted to reproductive organs. So everything is affected, and then it is going to give you those symptoms if that self neglect continues. Yeah. So that is why, to understand how you are as a person and what are the things that have changed recently. Yeah. And then the points I'm going to mention about taking care of yourself. So that's these are the things that can get affected about you. Relationships can get affected, relationship between you and your partner. And if you are somebody who has got secondary infertility, already has a child, one or two or more, and wanting to get pregnant next time and it's not happening, then those relationships are affected. Relationships with your parents are affected, with your other friends are affected, maybe with your brothers and sisters are affected and reflected in your the way you are behaving, and they're going to think what's going on if they do not know that you are going through this journey. So all everything around you gets affected when you are not looking after yourself, you're not happy and healthy in yourself. Yeah. So so that's what happens when you are neglecting taking care of yourself as a person. And then what are the things that we can do to, and little things. Okay. Many a times when I give suggestions and people say, oh, but who has got time to do an hour of yoga? Who has got time to do even half an hour of yoga? Don't do half an hour of yoga. Do 5 minutes. Have you got 5 minutes? Have you got 2 minutes? Have you got to do just one posture of yoga? Have you got time to do one breathing exercise of pranayam? Do that. Yeah. Whatever little you can start from. And once you start to see and feel the differences as well, perhaps you're a bit more motivated to look after and take care of yourself. Or maybe those 5 minutes are enough to help you on your self-care journey. Yeah. So taking that into account, yeah, taking your self-care in your hands, because nobody else is going to do this for you. You will have to do this for yourself. Yeah. And 5 minutes, 2 minutes, 10 minutes, whatever that little time you have. So that's where time management or managing yourself also comes into play. How do you run your day? Are there certain times or certain other activities where you can reduce time and add some time to your relaxation, to your something that you want to do, which is going to help you on your self-care? Yeah. So it is also about managing yourself, and then actively adding certain things to make sure that you are aligning yourself. So if you are somebody whose digestion gets really directly affected when you are worrying and you're thinking about things, then you have to make sure that when you are worrying, you're even more regular in eating your food. Yeah. Because that's what happens. The thing that gets affected the most, either the sleep or the food, and that's get neglected the most. So that needs to be addressed first thing. Yeah. So you will be feeling signs of not eating well, so there won't be enough energy and maybe more constipation. So you realize, okay, this is I'm starting to get affected here. My digestive system is getting affected, and my digestion is getting affected here. So I need to make sure that I am eating definitely on time. I'm eating the right kind of food that is good for me. Yeah. So if sleep is affected, say for example, and you are normally you're sleeping fine, whatever number of hours you are sleeping, that's fine. But you now are, getting up a bit more, 2-3 times at a night, then you know that that's when you need to have a good sleep ritual. So depending what are your symptoms and signs of self neglect, then accordingly we're going to put systems in place to help you with those areas of your life. So when you're trying to get pregnant and going through all that, the whole journey of whatever that is, natural conception, assisted conception, IVF, IUI, whether it's for out of the couple, if it's for the man and he's going for different sperm tests, whatever that is for you as a couple, as a unit, then going through all of this and looking after, accordingly and doing it every day, little by little. That's what we want to do with self care. So, few things, about self care. Yes, eating on time, eating regularly, sleeping on time, sleeping regularly, having good sleep ritual. Food and sleep are the two main pillars that you need consistent, that you need uh, there, to be balanced and aligned with you, and not you cannot ignore them. And also specifically for fertility, you cannot ignore not sleeping well. So doing ritual, sleep ritual is great to get into the mood, slowing yourself down, maybe having a bath, massaging yourself with nice warm oils, or using nice fragrant essential oils, and getting into that habit of sleeping well on time, or doing everything that you, if you understand it yourself. If you don't understand it, of course you can take help of a professional, go to a practitioner and do that. Understand, that why is this happening. Because that's the other thing, many a times couples or women are not understanding that there is a correlation between them not sleeping and hormones not being replenished well. Yeah. So food, sleep, taking regular intervals off. If you are constant, somebody who works constantly on the desk, then taking time out, what they say, every hour, after every hour, you get up from your desk, have a big stretch. If you have the garden, doesn't go around the garden once and come back and sit on your desk. If you can't do that, take a pause. If you can, of course, take a pause from whatever work you are doing, or if you're working on a document, take your eyes off screen, do a big stretch. You can also do pranayam or breathing exercise at that time to help balance yourself. Literally 2 minutes. Yeah. Hi, Preeti. Thank you so much for catching me live. So taking regular intervals off from whatever you're doing. If you're somebody who's in the field work, or you are driving too much out, or you are doing other things that involve you going out and being on the run whole day, not run practically, but driving or in the car or walking a lot, then you need to take time to sit down. If you are in a job where you're standing a lot, then to take time to sit down again every hour, just a minute or so. Give little rest to your legs. So whatever that activity is, if it continues on that, kind of goes on and on through the day, then breaking that into parts. And also you can go away from your desk, go away from your job situation, and have a sip of water, have some warm herbal tea. All these little things add up to your self-care. You'll be amazed eventually at the end of the day when you don't do any of these, or you do less of them, and then when you do them regularly, the kind of difference it makes. Yeah. So that, what else can you do? You can if you are somebody where you really enjoy a cup of tea, cup of coffee in a day, and you really look forward to sitting down with your cup, you have a specific space and you give yourself some time to just contemplate. If you are a person who meditates, who sits down and be silent for some time, then do that. I always say to my patients that we all have to live, and we all have to feel happy and content about what we are doing as well. Yeah. If something, that's why I find certain ideas of, for example, dieting or cutting certain things out of your food or cutting things out of your life so difficult, because it creates that mindset of being in lack, and you feel that, oh, I'm not enjoying this because I really like my coffee. Yes, you can't have, if you are somebody you're having 7-8 cups of teas or coffees a day, yes, you can't have that many, but you can allow yourself 1 cup of tea, coffee a day, the one which you really are going to take time to enjoy, because that is going to add to you feeling content and happier, and that is more crucial then I think one cup of tea or coffee is allowed. So making it also realistic, making it also something that it's not an idealistic advice. I personally do not like to just give an idealistic advice. Yes, in an ideal world, we wake up certain time, we go to work, come back 5 o'clock, make dinner, eat before 6. Not possible. Not possible for everyone. Um, I sorry, there's a question before I go forward. Cloudy mind, sometimes thoughts and list of to do things are so overwhelming. There's yeah, absolutely, absolutely, and that's where the power of making there is this is a management tool that people use where you make 4 parts. You divide your work into 4 parts: the one which is crucial, one which is important, one which is crucial but not urgent, one which is important and urgent. So I can't remember all 4 of them exactly, but that's how you can prioritize your work. Something which has to be done right now, right away. Yeah, so focus on that first. If you can think about, okay, this I can do at the end of the day, then you make a time for that. At this time I'm going to be focusing on this. So then completely take that thing out of your mind, because it's not required, it's just taking up your mental space. So for that, yes, making list, but you have to make realistic lists also. And I'm equally to be blamed. We think that in an hour we can do 100 things, or I think I can do million things, and I don't. So making realistic list, and also if you allow time for, say, a certain task that you have to nip down to co-op and you have to get something, if you're allowing yourself 15 minutes, double it up. Yeah, anything can go wrong. You don't find the parking, you have to go around twice the block to find the parking, and then you used up all that time. So all these practical things, little things, they add up to the stress. Yeah, I mean, I know that I can get worked up. Anybody, I've seen people where they're worked up because they can't find the parking and they're just so annoyed with them themselves. So make a list, but list is also in the way of priority. What is the priority right now? And then it goes down the priority accordingly. And then you list yourself. If one day you have, say, for example, you made a list of 20 tasks for a day, and out of those 20 tasks in that particular day, you being fully packed up for that day, you only did 10 tasks, then you know that you physically are only capable to do 10 tasks a day. So for next day, only make a list of 10 tasks, right? So it is a time management thing. It's a management of ourselves, and also to look at our lifestyle, our day schedule, where what is it that is wasting my time or using up too much time? Can I delegate this to someone? For example, I do not like to go out and do the shopping. So online shopping works really well for me because the person delivers and you are not using up that much time. Yeah. Just imagine if you have to then go out and spend that time. So I hope I'm making myself clear, Preeti, if you are understanding what I'm coming at. But it is an assessment of our days. It is an assessment of our times and schedules, and then making that list, and making that list of however many tasks you are able to do that day. And then if you then have some time left, then you can do the tasks from the next day which are not that important, and you can add them to your list. So it is about being realistic and not bashing ourselves up, because we are only one person and there's only 24 hours in a day. So organizing ourselves is crucial to feeling less overwhelmed and less stressed out. And also, many times we have this habit of, it's like we have this mind map in our mind which has got all the tabs open. So you can see all the 20 things in front of you that you have to do. Again, not going over and over. So if you have made a list, this is the first thing I'm going to do, then the second one, then the third one. And I'm going to go down the list and you tick it off. Yeah. Great if I'm making making sense here. But this is managing, organizing ourselves is a self-care tool because it avoids all this hassle, it avoids all this overwhelm, and we are thinking, oh, I must be doing something wrong. Other people are doing so much work, and I have only gone down to second point on my list. But you got to make a list that works for you and not for anybody else. Nikha Chandra Arora, yes, you can ask a question. Feel free to ask a question. I'm just going to be few more minutes. I do have another meeting to rush to. So yeah, so self-care. I was talking about, and I'm here just brainstorming with you, all of you, is about practical little things, and every little thing that you can do, it adds on. So it's not about all the big things. Yes, big things are there as well. Okay, this one is particularly in relation to getting vaccination when you're trying for a baby. So as far as I have read the literature and the scientific advice, we have no proof to say that it is damaging to women who are trying to get pregnant. So as far as science is concerned and as far as medicine is concerned, they are doing studies on it, and they haven't found anything that it is affecting women who are trying to get pregnant. The rest is your personal decision if you do want to take it or if you don't want to take it while you're trying to get pregnant. But it is, according to medical community, it is safe. I hope that answers your question, Nikha. So yeah, okay, self-care. And I was recording my podcast, which got disturbed by a phone call. So I don't know how much it is recorded. So yeah, taking little steps every day. And you cannot put your self-care on the side that, no, I don't have time to look after myself. I'm good with going for 4 hours sleep a night for days and days and weeks and weeks. It is not going to be good for your body. And it is definitely not going to be good for your fertility journey overall. And that's why taking an assessment of your whole day, if you work, if you don't work, and then putting system in place which works for you through the day, so that you have that little bit of time to yourself, where whether you want to have a cup of tea or you want to have a little herbal drink, or you just want to sit and take time out, do nothing, or you want to go for a walk, literally 5 minutes walk around the block, whatever that time you want to utilize for, or you as a couple want to sit down and have meal together, which is highly crucial. So all of that has to be put realistically into your time scale, and then have that time for yourself when you care only for yourself as a couple also, but also only for yourself, taking that time out. All right. Thank you so much for your questions. And I think I've done, we are good for today, and we can revisit all these topics. They're going to keep coming back in another form and shape. And, maybe there are some other books out there, maybe some scientific literature I can check out on this. So I'll keep adding. Every Wednesday, every Sunday, I will be talking about issues, things that are related to fertility journey, not necessarily only medical things or medical topics, but other topics and issues and things surrounded around your life or those people's life who are trying to get pregnant right now. That's great. Thank you so much, guys, for asking questions, and I hope you got your answers. And I leave you to a great Sunday so that you look after yourself and take that time off, some time off through the day. Thank you so much, and bye-bye.